Hey, good morning, everyone, and welcome to the second edition of Health Talk. Again, it's, third edition, I'm sorry, sponsored by Providence Health and Services, Western Montana. And our guest in studio this morning is Carla Davis. She is with, of course, Providence Health and Services, Western Montana. And you are a palliative physician, right?
Correct. I've been a family doctor for more than 20 years, and I'm also certified in hospice and palliative medicine. So my current gig is excellent. I get to see patients and families in their homes, nursing homes, sometimes in the clinic, and we talk about what's important in their life.
Right. Now, she gets to drive around in a really swanky Mini Cooper, too, which is like the coolest office in Montana.
I like it. Could you explain what palliative care is all about, please?
Palliative care is more of a model of care that works with your primary doc, your internist or family doc, oncologist, cardiologist, so we're an extra layer of support for patients and families at any stage and any age, especially if they have some type of serious illness and they're suffering. So we can help with symptom management, pain, shortness of breath, and also support for the patient and family.
How do you know when the right time is for a doctor to call in someone like yourself to assist with a case?
I would say that most doctors are doing some level of palliative care with their patients. There are certain situations where maybe we should have a flag that says, this would be an excellent time for palliative care.
Right,
would you like to know what those are?
Sure.
Let's say someone has significant emphysema, congestive heart failure, and they've been in the hospital 3 times last year. They have a trajectory that's kind of like a roller coaster. And the family says, oh my goodness, it was just like a roller coaster. We didn't know how it was going to turn out. And then over time, we can predict possibly they might go to the hospital again. And with palliative care, we can talk about how to improve their quality of life, shortness of breath, energy, and do they really want to go to the hospital, or can we make another plan next time they get sick?
Okay. All right. So if you wouldn't mind just telling me, well, I'll just relate a personal experience. My mother-in-law went to St. Pat's, and she passed away a couple of years ago. And the folks who were there, she had congestive pneumonia. And the doctor told her when she was laying there in the hospital bed, we're all there, the whole family, very large family. And the doctor said, her name is Mary, Mary, I'm sorry, but you're probably not going to be getting out of that bed. And that was a really difficult time for her to be able to accept that. But once she absorbed it, and then, of course, the wonderful staff there at St. Pat's just, surrounded her and the family with all sorts of terrific services. And we literally would not have known what to do if it hadn't been for you folks and what you guys did. So it was wonderful.
Well, that just is a reflection that we're all going to have a terminal event at some point.
Right. Mm-hmm.
And how do we prepare for that? First of all, we need to know what is going on. And then the next part would be advanced care planning. Did you ever talk to your mother-in-law before she got sick, how she would want things to go? Most Americans say they want to stay in their home, pass away surrounded by loved ones. We can make that possible sometimes. And other times we can do better care right there in the hospital with that same kind of support.
Sure.
But the key is acknowledging to everybody, what do you understand is going on, and what is your hope?
So it sounds like you kind of have a similar job to what Peter and I do. You have to ask people what could be some potentially tough questions, right?
We have to ask because we can't assume to know. For example, if I'm really sick, you don't know by looking at me what level of care I might want. Not to say that more care is not always great. It just may not fit with what my needs are. And that's why perhaps I've talked to my decision maker, the person closest to me, to tell them what I want. And maybe we've gone another step and put it in writing. You've heard about advanced directives, living wills. This can take many forms, but the more important piece is the conversation. And that should first happen with family and then the healthcare professionals.
I bet a lot of people are insecure about talking about death. I know people that I know are. So how do you broach that topic and get people talking, and what kind of questions do you ask during the session?
Well, this is April, so what did we do on April 15th?
Tax day.
All right, and so what's the other thing that's not optional?
Gotcha. It's death and taxes, right?
Right.
Thank you, Will Rogers. Yeah.
Right. So if we start incorporating our conversations about how we're going to live best, we start asking this at your checkup when you turn 50. And then perhaps every 5 years, and reassess what are your goals and what new has happened. Maybe you want to change your surrogate decision maker. You got divorced. Perhaps your divorcee isn't the one who's going to say whether or not we pull the plug, so to speak. So the conversation isn't as hard when we just talk about where do we see ourselves. So if I see someone who's 90 and I say, where do you see yourself in 10 years? Guess what they typically say to me? They say, oh, for goodness, I hope I'm not still here.
Right, yeah. That's is that that's not surprising to you, though, because you've been doing this for quite a while, and so that you kind of anticipate that sort of comment, right?
I try not to anticipate, because that's the point of asking the question, is that I don't already know the answer.
Sure. Okay. All right.
Now, when you're talking to people and coaching them through, do you find a lot of similar responses, or what are the options? I guess for someone like me who hasn't thought about death a whole lot, it's not something that comes up top of mind.
He's just a youngster, you know.
Well, I would say that in palliative care, not all of our patients are expected to pass away in the short term. In the long term, yes, definitely they're all going to pass away. But in palliative care, they might be suffering symptoms of cancer that is treatable, so they may not be terminal. But one of the questions that I ask people, it seems to catch them off guard, is, what are you going to do for fun today? And so in the midst of being ill and just using all of your energy to get through the day and to the next appointment, some people forget how to have fun. And in that situation, I feel like they're not living the best that they can while they're alive.
Just one example, if I may, again, throw in a personal example here. In our family right now, we're going through a type of event like this. And the person involved knows what's going on, very, very smart, very well educated, has made lots of very good decisions. And they decided as a family to, about 3 weeks ago, they just up and spent 3 weeks in Arizona. Just hanging out, going to baseball games, preseason baseball games, enjoying the sun, and doing everything that this individual could do within the limits of her condition. But still being able to plan and carry out things, if you will, a bucket list. Now, is that something that you also talk to folks about? I remember there was a movie several years ago called The Bucket List. Is that something that you encourage people to do, to pursue, and to try to help fulfill themselves?
Well, absolutely. You want to see what the goals are, but I would say that's an important question for each of us every day, because I can't tell by looking around the room who's going to be here next month. So why do we put off those important things?
You bet. Well, we're up against a break. We do have all three lines open. If you'd like to ask Dr. Carla Davis, here with us from Providence Health and Services, Western Montana, if you have a question about palliative care, give us a call. We'd love to visit with you, 721-1290 or 1-800-568-5309. You can also ask your question on our Facebook page, and we'll make sure the doctor gets it. We'll be right back. And we're back on Talkback. And, of course, it's Health Talk. This edition brought to you by Providence Health and Services, Western Montana. And we do have a caller on the line that has a question for Dr. Carla Davis. Is with us this morning here in studio, and it's Dick. Good morning, Dick. How are you?
I'm doing fine. I just had a thought. There's been a recent situation with a friend of mine passing, and I wanted to find out what are the different forms of dementia, and how does it manifest itself in this? You're talking about palliative care, and I associate the word palliative with the kind of things that you do to keep people comfortable in their last days.
Thanks for your call, Dick.
Thanks, Dick. So go ahead, Doctor.
So, Dick, what I'm hearing is your friend had a condition, something called dementia, and eventually passed away. What I'd like to kind of comment on about that is that dementia it's a terrible disease, and in this room, we've got 5 people, one in 3 could suffer it at some point. If we're going to talk about our advanced care planning and our wishes, we should probably do it before we end up with severe dementia. So this is where it would be helpful to have those discussions early on to identify who's going to help with these decisions. What kind of care are we going to give our best friend? when things inevitably change.
Now, Doctor, does Dr. Davis, does some of this have to do with genetic predispositions? For instance, if somebody in our family history had dementia or Alzheimer's, and you realize, hey, this is part of my family background, so maybe earlier on I can have these discussions with my family to kind of head that off, just in case.
Well, we'd say we're having these discussions early on, no matter what our conditions are, but you might be Muhammad Ali and had, some other cause of your dementia,
right?
Perhaps repeated brain trauma. So all of these are significant and irreversible. So as far as what are the different types of dementia, we don't have one that we can fix at this moment in time.
No, when it comes to, I know my grandmother she was kind of lucid at times and other times wasn't. And so that was difficult for us to know what kind of grandma we were going to walk in and talk to. One moment, she wouldn't know my sister. At another moment, she knew her name but thought she was another girl from her childhood. So how do you deal with the planning aspect when you don't know if someone's at full cognition all the time?
Well, that's why over time, as families or close friends, we do have these conversations. When someone else got sick, how did we respond and best care for them? And did grandma have an emotional response and say, oh my goodness, don't do that to me? So there are things that you may have heard that will give you some indication about her wishes, but for that person, the best that you can do is just be in the moment at that time. And probably the hardest thing with dementia is not to argue with them, because what's the point?
Yeah, that's very difficult. Now, I wanted to ask you, what is the 5 Wishes document? What's that all about?
Well, as we're having the conversation about our wishes and our future care, it can take several forms, and so we have different documents. One could be the 5 Wishes form. Another form is a My Choices form, and they go on and on. But they primarily list who you are, who you would decide to be your alternative. Maybe you're going to be temporarily incapacitated or permanently. There's no way to know. But who do you trust the most? And then how much latitude would you like your decision maker to have? And what are the absolutes? What are things that you definitely would want or would not want? Now,
let me ask you this. At what point does this become a legal document? I realize that I can sit down and just pencil out, well, I like to do this and I don't want to do this. But at what point does that become legally binding for the healthcare institution to follow?
Well, Peter, if it's going to be legal, you should use a pen. So,
gotcha. All right.
In Montana, you can write this on any type of scratch paper. We would like to have your name and date of birth on each page, and it should be witnessed by 2 people. Okay. And one of those probably shouldn't be your doctor.
Okay.
And then that's a legal document to help inform in the future. But if you've never told your decision maker that they're it, they have every right to disagree with what you've written down. So as far as legally binding, we're probably not going to throw your loved one in jail for disagreeing with what you've written down. It would have been better if there'd been a conversation. And some people then find out maybe they better pick a different decision maker.
So it doesn't have to be like notarized or any of that thing, right?
Doesn't require a notary in the state of Montana. Okay. Now, keep in mind, we have several different health systems here in Missoula. Community Medical Center has one medical record. St. Pat's has another. And if you dropped off this document to your provider more than 5 years ago, it exists in a paper chart and it may not be in cyberspace. So it would be good to bring another copy to your provider. And we tend to update these every 5 years. So as I mentioned, on your 50th birthday, your doctor should be talking about this.
Now, when do you recommend that people come in? Obviously, come in before you have the problems, right? Start planning before you need to plan. So when is a good time? How do people start that process?
So often at your physical, your doctor will say, here is this form. It's called a 5 Wishes, and it cost me $1.50, so you better fill it out and bring it back.
All right. So those 5 wishes are pretty much up to me, right? And I take that home and sit down with my beloved spousal unit and say, here's this 5 wishes. Can you help me fill this out? Because, if I do it, I'd be terribly irresponsible. But, just almost sit down and have a family discussion about it, right?
Exactly. And typically what'll happen is that next year when you come back for your physical, we ask about that little green booklet and you say, I know where it is. It's with my bills to be paid and I'm going to get around to it sometime. So it does take people a while to kind of warm up the idea of doing this. And sometimes it happens more acutely. For example, if your best friend suffers a significant event, it really lights a fire under us to have those discussions.
Go ahead.
Go ahead.
Yeah.
I was going to say, I hadn't heard the term advance directive until about 3 or 4 years ago when we were speaking with your compatriot Linda over here. And, I always thought that, you draw up a will, and that's basically what happens to take care of your life planning afterwards. What is the difference between what we think of as a will and an advance directive?
So an advance directive can also go by the term a living will. They talk about your wishes for health care specifically before you've passed away. So after you die, you don't have any more health care wishes. It pretty much ends there. So we want to make sure you get the best care and care that you want, and that's where the living will comes in.
Okay, we're up against a break. 721-1290 is our number. We'd love to hear from you. Dr. Carla Davis is with us, and she is a palliative specialist, a palliative care, Providence Palliative Care Services with Providence Health and Services in Western Montana. This is Health Talk, and again, all three lines are open. It's 721-1290. We'll be right back. And we're back on Health Talk. 721-1290 is our number. Just a few more minutes if you want to get in touch with Carla Davis. She's a palliative care services specialist at Providence Health and Services, Western Montana. Now, wanted to bring up something that I think I do a real estate show, okay? And one of the things that we've come up with is the phrase knowledge is power, okay? And so when you sit down with your family members or your friends, or whoever the three people are that are going to help you with this document, I think it empowers you because now you know that even if the worst happens, you are ready. Everything is basically all your ducks in a row, and that has to be extremely comforting to folks.
Well, I can tell you from families that haven't had this type of conversation, it is a very big burden to try to second guess what kind of wishes they should put in place.
Okay.
And you were mentioning that you do these, try to upgrade them about every 5 years. Do you find that people change a lot of their answers to the questions? And does modern technology change some of the possible options?
I would say that what changes most frequently is, who's on base and who's up next. So that is very important. And filling out these forms isn't necessarily straightforward because the terms, we're assuming you understand what we're talking about. So actually we do have a service in place where Linda Bierbach can sit down with families. She can have, 2 or 3 family members do this at one time.
Come on, Linda, grab that microphone. You've been sitting silently there the whole time. So tell us about this process from your point of view as an RN.
In support of the advanced care planning process. To define advanced care planning, it is a conversation that occurs over time. As Dr. Davis said, every 5 years you kind of update your template, in other words, your advanced directive, to reflect your current state of health and your choices. And in this conversation with patients and families, with a guided facilitation, you give people the opportunity to reflect and to discuss and then to name their choices. That being said is that there are upcoming educational opportunities that will be available at clinics where you get your care, where we would do some education and then provide documents to help fill out your forms, as you said, take it home and fill it out with your wife.
Sure.
And or have a conversation with someone like myself to help them script and understand and write down what they want.
Now, I want to ask Dr. Davis, are there some things on our list that you as a medical professional will look at and say, you know what, in your current condition, we just can't do this or this or this? Is that part of the back and forth that you do?
Yes, we call it shared decision making. So part of that means giving the person the information. How that might look would be, let's say Grandma is 100 and has very brittle bones and says, I want them to attempt resuscitation. Mm-hmm. And we talk about what that might look like. Sure. An effective CPR might not help Grandma. In fact, the studies show about 0 for her to recover from a CPR
Sure.
type of care. So having that discussion, I would say, after fully understanding what it is, she may reassess her wish. But it's still her wish. And we do have people that have choices that seem to be more aggressive than I would choose for myself, but that's okay because that's why I'm asking the question.
We have exactly 1 minute left in the program, so I want to get some contact information. How do we contact Providence St. Patrick Hospital and your department specifically?
Our palliative care suite has its own phone number, 327-1950.
Okay, and for folks who want more, can we go online to the St. Pat's website and find out more information on that? What do you think, Linda?
Well, again, with advanced care planning, one of the quickest routes is really to call 327-1950, and then we can help guide those accesses to resources.
Perfect.
Specific to this.
I want to thank both of you for being with us this morning, Carla Davis, Linda Bierbach, and we will do it again next week, ladies and gentlemen. This is going to be a continuing program here on Talkback. It's called Health Talk, and it's sponsored by Providence Health and Services, Western Montana. Thank you, Dr. Davis.
Thank you.
Good to see you. And we will come right back and have more of Talk Back in the 9 o'clock hour.